UroPatient. Tune in and see. Power your health for you and me. Knowledge is power. Power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient. I'm your host, Vic Senese. Hey, be sure to like and subscribe to the show. You guys are tearing it up on that, so keep doing it. Today, thinking about a penile enhancement? Before you try anything, you need the facts. On today's episode, I'm going to break down what actually works and what's safe and what you should absolutely avoid. From pills and pumps to procedures and promises that sound too good to be true, I'm going to cut through the hype with real evidence-based guidance. Don't risk your health chasing myths. Get the truth you need to make smart, confident decisions. So let's roll it, and I'll let you know what I think or what you think later.
You know, if you've spent basically any time on the internet, you have seen the ads. They are everywhere. They're promising bigger, better, everything, with pills, pumps, all kinds of procedures. It's a topic that's surrounded by so much marketing hype and a lot of very real questions. So today, we're going to cut right through all of that noise and get straight to the medical facts.
Okay, let's just get right to it. The one question that really, truly matters here. Do any of these products, all these things you see online, do they actually deliver on their promises? Let's get the verdict right from the jump.
And there you have it. That's a really clear, direct statement from the Mayo Clinic. So it's not just that these things are a waste of money, it's that some of them can be actively harmful. This one quote really sets the stage for everything we're about to unpack.
So to really understand the why behind that statement, we need to look at what the leading medical organizations have to say. Let's dig into the official consensus from the actual experts, the urologists.
Here's the crucial point. The American Urological Association, you'll see them referred to as the AUA, they've had a position on this for a long time, and it's based on hard evidence, not on some flashy ad campaign. They make it super clear that when we're talking about purely cosmetic changes, most of these procedures, well, they just haven't been shown to be safe or effective.
All right, now let's get specific. Let's break down the most common non-surgical stuff that you've probably seen advertised all over the place. This is where we separate the marketing hype from the cold, hard clinical reality.
You've seen them all, right? The pills, the lotions, the vacuum pumps, and these stretching devices. They are absolutely everywhere online, and they all make some pretty big claims. But what does the actual evidence say?
Okay, so this chart really lays it all out. Just look at that evidence level column. For pills and creams, it's either insufficient or flat out not supported. For pumps, any effect you see is just temporary swelling. Now, traction devices, they do show some low to moderate evidence in a few small studies. But look at the drawback. It takes 4 to 9 hours of daily use for months. I mean, honestly, who has time for that? The dropout rate is huge for a reason.
And we have to talk about jelqing specifically, because it's often pushed as this natural method. Well, the medical community is very clear here. There is zero scientific proof that it works. In fact, this is a perfect example of that risk we mentioned at the start. It can lead to permanent damage. We're talking scarring, pain, and even disfigurement.
So the takeaway on all these non-surgical options is pretty simple. Not only is there a lack of scientific proof, but because these things are often sold as dietary supplements, the FDA doesn't even require the makers to prove that they're safe, let alone that they actually work. Okay, so if the pills and pumps are a bust, you might be thinking, well, what about the more extreme option? What about surgery? And yes, surgical options do exist, but they come with a completely different and much more serious level of risk. I want you to notice that word right there, investigational. That's the AUA's official term. What that means is that even the top medical experts in the field view these surgeries as experimental. They are not standard recommended procedures, especially for men who are already in the typical size range. So there are a few main ways they do this. The first one, cutting the suspensory ligament, it just creates the illusion of more length. It doesn't actually change the size, and it can cause instability. The second, injecting fat, often ends up looking lumpy and uneven, and your body just reabsorbs the fat anyway. And then there are implants. Let's just pause on implants for a second, because the data here it's frankly alarming. This number, 67%, comes directly from a study in the Journal of Urology. It found that when a popular implant called Penile had to be taken out,
A staggering 2/3 of patients developed a disabling curvature. And as you can see, the problems didn't stop with just curvature. The very same study found that after the implant was removed, 58% of men experienced penile shortening, the literal opposite of the desired outcome, not to mention the high rates of infection and new onset ED. These are incredibly serious, life-altering complications. So if the products are ineffective and the surgery is just plain risky, what's the answer? Well, this is the part where we pivot. We're going to stop debunking myths and start looking at what the experts say actually improves sexual health and confidence. The real key here is to shift the entire focus. It's about moving away from a single measurement and instead looking at a more holistic, bigger picture view of your health and well-being. This is where real, lasting improvements are actually made. And the Mayo Clinic recommends 3 concrete, safe, and super effective steps. Number 1, communicate with your partner. Number 2, get in shape. Losing excess belly fat can actually make your penis appear longer, and it definitely improves stamina. And number 3, if these feelings just won't go away, talk to a professional, like a counselor or your doctor. This quote really gets to the absolute heart of the matter. Intimacy and true satisfaction, they're built on communication and connection, not on chasing some physical ideal that advertisers literally invented to sell you something. Okay, so let's bring all of this together. Let's highlight the most crucial takeaways from all of this medical evidence, the things you really need to remember. First off, let's just get some perspective on size itself, because this is where a lot of the anxiety comes from. The fear of being too small is super common, but the medical experts are clear. An erect penis of 5 inches or more is considered typical. The actual clinical definition of a micropenis, which is a condition that warrants medical attention, is less than 3 inches when erect. The vast, vast majority of men fall well within that typical range. So here are the 4 key points to walk away with. 1, most of these products just don't work. 2, surgery is really risky and considered investigational. 3, most men who worry about their size are, in fact, typical. And 4, real, genuine confidence comes from your overall health, your fitness, and open communication. We're going to leave you with this question to really think about. After looking at all the evidence, the useless products, the dangerous procedures, maybe the entire conversation just needs to be reframed. What if the goal isn't enlargement at all, but just enhancement of your total well-being? Because that's what the science actually supports.
So some good information that I wanted to share with you about, the kind of the truth about penile enlargement. Now, it really is kind of a decision such as breast implants to make your breast larger. Doesn't mean you need it, but for some men, it's, they want to have cosmetically want to have enlargement done. So next week, I'm going to have Dr. Pash on. I did an interview with him for UroNurse, and he does a procedure where he implants or actually injects something called hyaluronic acid. You may have heard the term before. Women get it sometimes to kind of pump up their lips. Well, it can have a similar effect. So this is something that he's had a lot of success with. It was a really good interview with him. So I'm going to bring some excerpts from that interview so you can learn a little bit more about if this is something that you're looking for. Again, cosmetic, not that you have to have it done, but if something that you're considering, I thought I'd have an expert talk to you about what the procedure is. We'll do that next week.
From research updates to daily advice, Vic explains it all, simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, we make it clear. Every Saturday morning, the podcast is here.